Remind participants that they must present their valid NDI-20 in order to participate in the force evaluation. Without valid military ID, participants will not be allowed to complete the force evaluation. Reservists may use any government-issued photo ID. The D&D 279 is considered Protected A and must be treated as such. Have the participant fill out Section A of the D&D 279 Service Particulars. You will then verify that the required personal information is complete and accurate using the participant's military ID. Once completed, the CAF member will complete Section B, Health Appraisal. This procedure is necessary to identify potential health issues that require a medical consultation prior to an evaluation. Only participants who answered no to the first two questions and yes to the third question, and who met the blood pressure requirements, are cleared to undertake the evaluation. If the participant has an expired or invalid PHA, you will need to measure blood pressure prior to the evaluation. Manual blood pressure procedures for PSP evaluators or trained healthcare staff can be found in the Force Manual. For all other force evaluators, you will use the automated blood pressure machine. Have the participants sit for 5 minutes with their back against the chair rest, feet flat, legs and ankles uncrossed, and their left arm comfortably supported. Ensure the participant's clothing does not impede blood flow. Ask the participant to change their shirt if required. Choose an appropriately sized blood pressure cuff and apply it to the participant's left arm. Place the cuff around the bare left upper arm, with the lower margin 2 or 3 centimeters above the bend of the elbow, with the upper edge of the cuff level with the heart. Wrap the cuff evenly around the arm, tightly enough that you can slip 2 fingertips under the cuff's top edge. Instruct the participant to sit very still and to not move their arm, hand, fingers, or body during the measurement of their blood pressure. Any movement could produce a false measure of blood pressure or prevent the automatic blood pressure machine from reading blood pressure. Press the button to start the machine. Once the automatic blood pressure machine has finished measuring the participant's blood pressure, remove the cuff from the participant's arm. A participant whose pre-evaluation blood pressure is between 141 over 91 millimeters of mercury and 150 over 100 millimeters of mercury is permitted to perform the force evaluation without restrictions. The force evaluator will advise the participant that their blood pressure reading is slightly above the normal range and will encourage them to consult with their healthcare provider. Remind them that there is no cause for alarm and that consulting a healthcare provider serves as a simple safety precaution. Check off the appropriate blood pressure box of Section B of the D&D 279, indicating that the participant has OK, high, or over the limit blood pressure. Please refer the participant to a healthcare provider when the participant answers yes to one or both of the first 2 questions of the health appraisal, the participant answers no to question 3 of the health appraisal, and their measured blood pressure exceeds 150 over 100 millimeters of mercury or above after 2 attempts. The participant develops any symptoms which you or the participant consider to be abnormal. You become concerned for the participant's well-being, or a referral is requested by the participant. Participants referred to a healthcare provider will be provided with the applicable reporting form with the following information: Section A and B filled out. Ensure that the Referred to Healthcare Provider box is checked off in Section B. Ensure that the participant prints their name, signs, and dates Section B. And ensure that you cross out Section C and E and print and sign Section F. As an evaluator, do not attempt to diagnose or discuss in detail why the participant had a yes response or why their blood pressure is above the criteria for pre-screening. Prior to attempting the force evaluation, participants must have their waist circumference measured. Have the participant clear the abdomen and hip bone area of all clothing and accessories. You can use a clothespin to keep the shirt clear of the abdomen area. Take a position to the side of the participant's body at a 45-degree angle. The landmarks for the measurement are the superior edges of the hip bones. To locate them, have the participant palpate the upper part, top, of their hip bones until they locate the uppermost lateral borders of the hip bone at the midline, side, of their body. Instruct them to place their thumbs on both landmarks. Provide the participant with the end of the measuring tape and have them place it on the landmark. While the participant holds the measuring tape in place, have them turn their body to wrap the measuring tape around their abdomen. Position the tape directly around the participant's abdomen so that the interior edge of the tape is level with both landmarked points. Have the participant stand with feet shoulder-width apart and arms crossed over their chest in a relaxed manner. Ensure that the measuring tape is still in the proper position. Apply tension to the tape until it is snug but not tight so that there are no indentations on the skin. At the end of a normal expiration, take the participant's waist circumference measurement by using the cross-handed technique to bring the zero line of the tape in line with the measuring aspect of the tape. The measurement must be taken at eye level to ensure accuracy. To ensure the participant is comfortable, please follow the following steps. Waist circumference measurements must be conducted behind a privacy barrier, usually gym mats. The participant may request that they be measured by an evaluator of the same sex when possible. The participant may request an evaluator of their choosing. The participant may request to be measured in a separate room. If using a private room, the evaluator must ensure a third person is in the room at all times. To ensure accuracy and standardization, the force evaluator must measure on bare skin. If the participant declines the waist circumference measurement, you will indicate this in the waist circumference section of the D&D 279 form. Prior to attempting the physical fitness screening evaluation, participants must complete a warm-up and movement preparation specific to the force evaluation. The warm-up will include the following: light aerobic activity for 2 to 3 minutes. Dynamic movements for 2 to 3 minutes performed in a stationary position. During this phase of the warm-up, use this time to coach and correct on proper lifting techniques. The warm-up may also include a reduced version of each protocol at the discretion of the CAF member. Upon completion of the warm-up, allow an additional 1 to 2 minute warm-up period at the participant's discretion.